Hello, everyone, and welcome back to the Healthy Department, the official podcast of the Greenup County Health Department. I'm Andrea Collins, a registered dietitian here. Each month, we recognize a community member who is making a meaningful impact on the health and well-being of our region through our Health Hero of the Month series. For July, we're honored to recognize Scott Hill from UK King's Daughters. UK King's Daughters has been an incredible community partner, working alongside us on many health initiatives through our region. From supporting community outreach events to collaborating on projects that improve access to preventative health care, they're consistently demonstrated a commitment to improving the health of the people that we serve. So Scott, thank you so much for joining us today, and congratulations on being our July Health Hero.
Thank you. That was very nice. You surprised me with that. That was very nice. Thank you.
No problem. We appreciate everything that you do at UK King's Daughters and for our community. It does not go unnoticed.
Well, that's an honor. And, I was born in Greenup County and raised here in this community. And I worked for King's Daughters for over 32 years. So, it's pretty special for me to be in a position where I can just serve others and hopefully, make a little difference.
Yeah.
In a positive way.
That's awesome. I'm excited to talk with you today, so let's get started.
Sounds great.
Greenup County Health Department. Our legacy of health lives on. Greenup County Health Department. Public health is public wealth.
Before we dive into our partnership, we'd love for our listeners to just get to know you a little bit more today. So can you tell us just a little bit about yourself and your role at UK King's Daughters?
Yes, absolutely. Thank you. So I was born in Argolite, so I'm a Greenup County native and graduated from Greenup County High School. And I was fortunate to go to ACTC for a couple of years and then to Eastern Kentucky University for a couple of years to get my bachelor's there, and got my master's later at Eastern Kentucky University. And it's funny because my degree was in really safety and security. That was always my expertise. And so for about 25 years, I was director of safety and security at the hospital and for all of our campuses and everything. So you can only imagine what that was like for 25 years. But what an honor. And my career has certainly evolved. I went back a few years ago as if I didn't have enough education. I needed to maybe suffer some more. I went back and got my doctorate. And, it was just a great experience, too. I got a doctorate in leadership, but it really kind of helped open up my mind a little more to other things. And so I've been serving as executive director for community engagement and pastoral care for a few years now, and it's been different. And I still help with safety, security matters a lot. I still get those calls, and I try to be a resource. And how can I serve others in the community or my own hospital? But I've really been serving in this role that has really put me out in the community. And just every single day working with a lot of different agencies in the community. And it's just been an honor. It's just been really unbelievable. So that's a little bit about me.
That's awesome. So what kind of inspired you to pursue your career?
Well, it's kind of funny. Whenever I graduated from Eastern Kentucky University, I started working as a teacher's aide at Wortland Elementary School. That was the first place that hired me. So I was working as a teacher's aide during the day, and King's Daughters hired me as a security officer. And it was neat because it was kind of like I was kindergarten cop. I was working in the school system during the day. I'd put my security uniform on at the school, and then I would go, to the hospital and work all night shift as a security officer. And that was really my first taste of healthcare. So I did that for a good while and found myself being promoted to housekeeping supervisor. And then I was director of security and safety. And it just kind of, just kept just kind of seeing new opportunities. And really it was all about how can I serve? How can I help others? Like we wanted to start an ambulance company. I had the honor to help start that, and valet parking, and just, a lot of neat things over the years. But, looking back, I think God was kind of guiding me and directing me because just a lot of different opportunities. Chief privacy officer for a while. So I always joke and say, I've not done everything at the hospital, but most everything. A little bit of everything in my career. It's been a real blessing.
Yeah, and that's so interesting that you mentioned being involved in safety and security in the beginning of your career, because that really is one of the basic needs that help people achieve their optimal health. Just safety really has to be there for people to thrive.
It does. You know, you look at Maslow's hierarchy of needs that we learned about in psychology. One of the things you're going to learn about is you can't deliver outstanding customer care, patient care, customer satisfaction. It's not going to happen without those basic needs being met. And it really does get back to safety, security, shelter, housing, all those kinds of things. And so there's a lot of parallels that I see with being healthy that way as well. You know, you've got to have those basic needs in place if you're going to have that healthy life. I think in many respects, I can see a parallel between my role of many years as safety security director and now as, you know, executive director for community engagement. And I also get to do pastoral care at this point. I've hired all the chaplains, and we have a wonderful pastoral care department, you know, and it's unbelievable what our chaplains do every day as well.
Yeah, because I know sometimes that can be a challenging job. So making sure you have the right person to support families that are in tough situations is important.
It really is, and we're hiring people. Many of them have doctorates. They've got they're board certified in chaplaincy and all the above. So it's just amazing to see how experienced and how wonderful they are. But whatever that spiritual need may be, whatever that spiritual background is, they are capable to meet that need at that time.
Yeah, that's a great point. So what has been one of the most rewarding moments in your career so far?
You know, I guess thinking about that, there's a lot of them. I think back about a lot of different things in safety and security, and certainly you want people to go home safe. You know, I felt like I built a world-class safety security program that people were safe so we could focus on patient care. Very proud of that. But I remember several team members approaching me that used to work for me in housekeeping. And one of them in particular walked up to me one time and said, you know, I'm a social worker now. And I just want you to know we had one of those housekeeping meetings and you really challenged us to be our best. You challenged us to improve and to get better. And I just thought, wow, how powerful is that? He took time to come back and say, you know, thank you for challenging me. I'm a social worker now. I'm living my dream. I'm making a difference in other people's lives. And, you know, sometimes you wonder if you're really making a big difference. And sometimes it's those little things like that. Maybe you can inspire someone else. And, you know, I think back about that, and that's pretty powerful.
Yeah, that's such a great point that you make, because in leadership, it really is important to not just always be delegating, but encouraging your staff. How can you, you know, push them to be better and really and that helps them help community more.
It does. And I think, you know, one of the things that I learned early on is I think just being a servant leader. You know, I've had a lot of employees, a lot of team members that I've been responsible for over the years, but for me, it was always about how can I serve them? How can I help them? Make sure they have the tools that they need. If they're a security officer or they're a chaplain or they're a housekeeper, whatever it might be, just make sure they're equipped to do what they need. Do they have the tools? Do they have the equipment? Do they have the supplies? So I've always tried to approach it from a servant leadership mentality, and I think that makes a difference. And they see, you know, back when I was over housekeeping, I remember going out and running garbage. I'd go out and run garbage. And one of the housekeepers said, Scott, you're going to get that all over you. And I said, well, don't you? And he said, of course. And I said, no, I want to do this. And so, you know, over the ambulance company, you know, a few years back, I remember riding around in an ambulance and things. You know, I think it really helps to be a servant leader, to get out there and really understand what's going on. Then you can make better decisions on how to serve better. Yeah.
And I think that's so inspiring too, just coming from, you know, a worker's point of view. You being that leader and having that servant heart, it is also helping taking care of your workers who are taking care of community members. So it's all going down that chain, which is so important.
Absolutely. And that's our culture at UK King's Daughters. And I think you'll see that from our president CEO, Sarah Marks, who's just a wonderful leader, very compassionate, very much a servant leader. And I think that obviously patients are very important to us. We want to take very good care of them. We have incredible staff, incredible team members. But one of the things I really have learned is if you want to deliver some great patient care, take really good care of your team members. So I think that's been our culture there. How can we really take care of our team members, make sure we're meeting their needs? Even pastoral care today, I often say, we're not just here for the patients, but we're also here for you. How can we help you as well? And our chaplains all understand that as well. But no, I think servant leadership is so important for us to understand, and the culture, of that organization.
Mm-hmm. Yeah, that's so important and so refreshing to hear. Thank you so much for sharing. For those who may not know much about UK King's Daughters, can you tell us a little bit more about the organization and their mission?
Yes, and I've worked there 32 years, and it's been an incredible place to work, but our mission is very simple: to care, to serve, and to heal. And I think any organization should look at their mission and think about that, because sometimes we can get a little off track, get a little off target. What are we here for? What's our mission? But we're a 465-bed medical facility, licensed facility. We have just amazing amount of team members. I believe right now we're a little over 5,500 people. Wow. We're the largest employer, in the region. So I think we understand our responsibility as far as, economic development and all those kinds of things. I mean, we have a major stake in that, and we understand that with 5,500 plus employees, team members. But we were started in 1899, which is pretty amazing. We're 127 years old. I know we don't look it, right? But it's just funny. I think back about that. I was working there, Andrea, in 1999 when we celebrated the 100-year anniversary.
Wow.
So I still remember that. But 127 years old, just a neat place, a fantastic place to work. And obviously we've grown over the years, and I've been there long enough to see all the growth and all the changes. I helped start the ambulance company, and I remember when we started valet parking. I remember when we started doing all of our off-site facilities, and we've really developed with the hospital in Ohio and just on and on, the Kingsbrook Nursing Facility. Just been amazing what all's happened there since I've been there.
Mm-hmm. Yeah, I think that's so interesting, because even in my lifetime, I feel like I've seen UK King's Daughters change a lot. Of course, UK Healthcare came in.
Yeah.
And it's really interesting to see just the standardized healthcare that really has gone out across the region, which is super interesting and needed too, especially in these rural areas.
Yeah, I think so. And, you hope you never have to use the emergency department. But the reality is I've had to go there multiple times. My wife and I have raised 3 kids here in Greenup County. We've been in the emergency room more times than we would want to be, with little accidents or little things that occur. And, it's nice to know we have a major medical facility with incredible team members, amazingly trained physicians and others that are there ready to serve, and looking back, I was thinking about this morning. When I first started, we were King's Daughters Hospital, and then we became King's Daughters Medical Center, and then we became King's Daughters Health System, and now we're UK King's Daughters, and that's in my career in 32 years. So, and what's really funny is I remember when we opened our last ER about 30 years ago, we opened a new emergency room. That was 30 years ago. And we just recently opened another new emergency room. That's when I thought, wow, I've worked here quite a while. I've opened up 2 emergency rooms at this hospital.
Yeah, it can be interesting to see how just in a short period of time the health needs change, and you need bigger space, more different monitoring systems that need to be put in place. So I've been to the new ER. The space is definitely nice and was needed.
Absolutely. We were already really busy, and we had this incredible hospital, Our Lady of Bellefonte Hospital, and so many amazing team members and people that were there. And all of a sudden, it's closed. So we go from being busy to just what I consider, crazy busy. And, so the ER that I thought we built 30 years ago, I thought at that time, there's no way we're going to fill this up. Well, I certainly thought that this time as well, but the reality is we do need the space, and we do need additional nurses and more people because the needs are great. We have a lot of health issues, and with the closing of the hospital here, I think it even put more demand on the need for services.
Mm-hmm. And what are some of the biggest health challenges that you see affecting our communities today?
Recently I got to help head up our community health needs assessment to really look at the needs. I know we worked with the health department as well on that, but, several things that we looked at and we went out and interviewed some of the stakeholders. We did some surveys. So we looked at a lot of data. So this isn't just based on what we think. This is based on qualitative data, but also quantitative data. And the findings were pretty significant. I mean, physical inactivity is a big one. I think poor dental health is a big one. Obesity, we heard about that multiple times. Chronic health disorders such as high blood pressure, diabetes, heart disease. These were some of the major things that we heard. Obviously, we still heard things like, mental health, substance use disorder, challenges with access to care. These were all significant issues that we heard about, along with several others.
Mm-hmm. Yeah, and I know here at the health department too, as you mentioned, we did a community health assessment here as well, and a lot of our health priorities lined up together. So it's interesting to see, even though, UK King's Daughters being based in Boyd County, here in Greenup, we're collaborating still to try to get both counties, back on the right track, what the community wants and needs,
I mean, that's for sure. And, I think what we all got to do is figure out what the needs are, and then as best we can, work together to meet those needs. I think that we've done a pretty good job of trying to figure out what those needs are, but it's a little more difficult to really solve all those needs. So I think that's the struggle. What I've learned is if I go out here to the parking lot, I can't move a car. Can't even hardly move the car by myself physically, but if all of us go together, if we get all the agencies together, we won't just move it, we'll pick it up. I mean, we'll pick it up and then put it where we want to. And I think that's the same thing with this. I mean, there's so many issues, and it's just very challenging to move the needle. But we are moving the needle in a positive manner, and we are all really working together. There's no doubt about that. So we're making some positive changes.
Mm-hmm. Yeah, I know in programs like the Healthy Choices Healthy Community Coalition and through programs like Grow Old Greenup, UK King's Daughters, we're all working together hand in hand to try to solve these health issues in our communities.
No, that's for sure. I mean, I help head up the Healthy Choices Healthy Community Coalition, and it's amazing. I mean, we'll have 40, 50 different organizations show up at that. And we all work together. We give agency updates. It's all about collaboration. How can we work together? I mean, if the Greenup County Health Department's doing a great job of addressing a certain issue, UK King's Daughters wants to get behind that. And we've got a lot of agencies doing some neat things that are experts in their certain areas. So I think what we've done a pretty good job of is recognizing that and say, hey, how can we support those agencies? We can make a difference with diabetes or, cancer care, heart care, et cetera, but maybe we're not the experts in dental care. But how can we get behind the people who, are making a difference with that?
Yeah, I think that's so interesting that you mentioned that, because just on the public health side, through just an example, Grow Well Greenup, UK King's Daughters offering to have physicians at certain events and offering that expertise there is really important, because, here at Community Partners, we're trying to do that nutrition education, meet kind of on a weekly basis. When meeting with a physician like that can be hard because they're busy. So having them be a partner and be able to come talk to community members is a really amazing partnership opportunity. So
absolutely. We just had one of our urologists speak at the Rotary Club. And I was there, and, it was like a free consult, and everybody was just asking questions, of this urologist that was there. And I think just getting out in the community, I spend a lot of time out in the community, and, we just want to be at the table. How can we help? How can we all work together? And I think the Healthy Choices, Healthy Community Group, if anybody's listening to that and like to get involved, reach out and let us know. But we welcome everyone's involvement in that. But we just need everyone at the table, I think, to really make a difference with these complex issues.
Yeah, I think you guys are doing a great job addressing those challenges, both inside and outside of the hospital.
Thank you.
Of course. One thing we've really appreciated in this partnership between UK King's Daughters and the Greenup County Health Department, like I said, is just collaborating on these different programs and coalitions. So why do you believe that partnerships between hospitals and public health agencies are so vital?
Well, they're extremely important. I think it goes back to what I said earlier. You just can't really do it on your own. You're so much stronger together. And right now we know what the big needs are. For the most part, we've done, I think, a good job, and your health department's done a good job of identifying the needs. But now we're trying to tailor services to meet those needs, and we need partners to help us do that because we can't do it all. We don't have the expertise to do everything. We have a lot of great resources, but we can't do it all, and we don't have expertise in all of those areas that's necessarily needed. But I think we're doing a lot of good things. We're doing a lot of education. We're doing a lot of screenings, in particular out in the community, for heart disease and cancer and diabetes, all those types of things. But it's very important that we leverage our partnerships. And I'm a big relationship person. So, your director here, Chris Crum, and I, we're very close, and we talk very regularly. How can we work together? How can we collaborate? But I think it's just so important to leverage those relationships.
Yeah, I agree. And I also know you guys have a big community event every year. It's coming up, isn't it?
Yeah, so we do have the Healthy Choices and Healthy Coalition scheduled for August the 20th, and that's at 10 a.m. at our health park. But the one you're referring to is our Healthy Hoopla, and that's a big event, and that's October the 10th at Camp Landing. And that is a really awesome event. I think last year we had 50 tables, all of them providing proactive, healthy education, and it's all free. I mean, we've had petting zoos. We, have EMS and police and fire out in the parking lot, and you got the different health departments there, and all these different agencies providing proactive, healthy education. How can I cook maybe a little healthier? How can I, tailor my exercise habits? We had Walk with the Doc, where you can just talk to a doctor, and so it's really a neat event, and pretty proud of that. This will be our third year of doing that. It's very family friendly. We had hundreds of people come out there to that event last year, and Camp Landing's kind of a fun place anyway. Mm-hmm. But then we throw a lot of education, free education, and free giveaways, and a lot of So it's a great way to have a good family fun day and make a difference, a positive difference in your health.
Yeah, and I think it's great you mentioned, too, it's at Camp Landing. You're really there meeting the people where they are. Camp Landing is always packed. So I think that's just an awesome thing that you guys have going on there.
That's one of the reasons why I like doing it there. People are there anyway,
Mm-hmm.
and then we do, I think, a pretty decent job of helping get the word out even more. And then we've had a lot of participation. Even the Ashland City Bus and other places have gotten behind us. They've helped provide free rides out there to the mall that day. So maybe we could target some people that otherwise aren't going to be there. So that's been, it's been really nice.
Yeah, because I know transportation is a big issue in our communities.
Yeah, we try to get some tokens and things for kids, maybe some of the ones that maybe don't normally get to go to Camp Landing, and we try to help them so they can have kind of a fun day too, and so a lot of the different places out there help donate things, and it's a great time. The community really comes together to make a difference in a positive way.
That's awesome. And it's great, too, the community, like you said, rallying together. That's what it's all about.
Mm-hmm. Absolutely. Absolutely.
So tell me a little bit about the impact you've seen from investing in prevention and wellness.
I think over the years we've seen a lot of different things that we can look at, and we've got some quality data and different things through the health system that we can look at, and there's definitely been some positive movements in that. But for me, I'm looking at our initiatives through the Healthy Choices, Healthy Coalition, all the different things that's broke out, and we did this process called ripple effects mapping. And you think about a pond, and you drop a gravel in that pond, and you just see all those little ripples go out. And we kind of mapped all of the different things that the Healthy Choices, Healthy Community Group Coalition's been accomplishing, and it's just been amazing. I mean, everything from, you think about some of the grants that we've gotten together, because when you do them together, there's a lot more power in that, but just a lot of other activities, and Healthy Hoopla, and a lot of things that's come out of that's been very powerful. But for me, sometimes I like to make things personal. And I think just from my perspective, I got to the age where it was time for a colonoscopy. And it was something I certainly wasn't looking forward to. And I was raised kind of like, if it's not broke, don't fix it. Like, that's just kind of how I was raised. That's not a right mentality. I recognize that today. But that's how we were more or less raised. That was our culture. That was our thought. And I think that prevails sometimes around, our region. People can get that mentality. But I do think proactive health care is so important. I did go and get my colonoscopy because I'm at that age. And they, in fact, did find polyps. And the doctor was able to remove all of those. And the doctor told me that if I had not had that colonoscopy, I would have full-blown colon cancer in 1 year. So, Andrea, it's very important that, and I know nobody likes it, but it's very important that we take care of those screenings and do those proactive health care tests and things that we're supposed to do. It might just be the difference between meeting your grandkids and not meeting your grandkids. And, I think it's very important.
Yeah, I think that's so important that you mentioned that. And do you have any advice for someone who may not have insurance coverage or anything? Does UK King's Daughters that you know of offer any programs for screenings?
I think, there's a lot of different screenings that we provide, and we do a lot of community service. We've got a mobile health units that go out into the community, and there's a lot of different things that we do. And a lot of things, free of charge, especially a lot of the screenings. And a lot of times what we're trying to do is get out, to the different places, like our Healthy Hoopla. We'll be at Camp Landing. We'll be doing a lot of screenings and things there as well. So there's a lot of resource. And if somebody doesn't know exactly where to turn, I would encourage them to reach out, to the hospital, reach out to me, reach out to the health department, and help us. We can certainly guide people on how to get those screenings.
Yeah, that's awesome. And it's good that you mentioned here, too, because we do have a referral process to help get people into screenings.
Yeah. I know you do, and I think that's wonderful. But I think there's, I hate to say no excuse, but, you probably don't have a lot of excuses. I mean, if you really want to take care of yourself, I think you're going to be able to do that, and we're going to do our best to help you. I think sometimes we just got to get out of that mentality of waiting until something's wrong. I'm of that age. I know that I'm at risk for cancer. Get my colonoscopy or go out and get my mammogram. I'm convinced if my mother would have had the appropriate proactive health care, she passed away when I was at Eastern Kentucky University. And I'll never forget that day my dad knocking on the door to tell me that. But I'm convinced if she had had proactive health care, she'd probably got to meet my kids. And I think about that a lot. So proactive health care is very important.
Mm-hmm. Yeah, and it's important to think about it, because life can be busy, especially the days seem to go by faster and faster. But again, it's important to take that time to slow down and focus on you and your health and, especially if you have family histories, making sure you're keeping that up to date with your doctor and just checking in at least once a year.
I think probably one of our challenges sometimes is I think we do a good job of taking care of others. I think we do a very good job. Like if you called me, Andrea, I'm going to do anything I can to take care of you. I think that's the culture that we have here, and that's wonderful. We're very compassionate. We're very caring. We're going to take care of our kids. We're going to take care of our family. We're going to take care of our community. But I think we're probably pretty poor at taking care of ourselves sometimes. And I think that's a good thing, but it's also a challenging thing. It's good that we have that heart. But I think self-care is so important, and I really want to encourage people to really have the freedom to take care of themselves. I think that we've got to recognize if we are going to take care of others and we're going to, minister to others, help others, whatever those needs might be, we've got to be able to take care of self, because if we're not healthy, we're not going to be able to help anyone. So,
yeah,
very important.
That's a great point. So, as healthcare continues to evolve and community partnerships become even more important, what opportunities do you see for improving community health in the coming years?
I think that social determinants of health is very challenging. If you've got a family who is in poverty, and we know we have some poverty, we know that there's poverty in our communities. It's going to be very difficult for you to focus in on your health care. So I think those social determinants of health is something that we're all going to have to consider. Things like transportation. If I don't have a working vehicle, how am I going to get to the doctor? How am I going to get to that screening? And I've bumped into people who have told me, like, I wouldn't be in the condition that I'm in if I would have been able to have gotten to my health care appointments. I've talked to those people, so it's so sad. But I think transportation issues, food insecurity obviously is another big issue I think that we're faced with. Housing, all of these issues, we don't necessarily think of them as healthcare issues, but they certainly are healthcare issues. And I think that that's some of the opportunities that we have right now. I like to look at them as opportunities. What can we do to make a difference with transportation? We have the van ministry through the hospital that we can help get people to their appointments, but also let's leverage all the other ways that we could address transportation. How can we do a better job? One of the things I just did recently was I looked at a report of one of the reasons people were missing appointments at the hospital. And there was a lot of people missing their appointments at the hospital because of transportation. So we know that's a significant issue, and that's something that we're looking at. But also food insecurity. How can we, work with the different food banks, Facing Hunger Food Bank, et cetera, to make a difference, with helping others in our community. And we've really got a nice partnership moving very nicely forward right now with Facing Hunger Food Bank out of Huntington, but they're the ones feeding all of our local food banks here. So how can we work with them more? They've even got programs called Food is Medicine. If you have a specific health diagnosis, the types of food and things that you eat can make a difference. So I think working on a lot of these complex issues is going to be something that we're all going to have to work together on to address.
Yeah, and that's interesting that you're saying that, because it's kind of like how doctors treating the disease rather than the symptoms. That's kind of what you're doing. Instead of treating, just on the healthcare side, you're looking at what's actually some of these root causes that is causing our community to have these poor health outcomes. So that's really great.
Yeah, and I think it's important. I know when I first got into healthcare, I didn't really understand social determinants of health that much. Is housing, food insecurity, transport, are those really significant issues? And I can tell you they are significant issues. And it's barriers that are really keeping people from taking care of themselves. So I think as we fix some of those issues, or at least make a positive difference in those issues, we'll see some positive improvements in healthcare.
Yeah, I look forward to working with you in the coming years and really tackling these issues. So.
Absolutely. I think working together will all make a difference.
Mm-hmm. What advice would you give organizations like UK King's Daughters that are looking to build stronger community partnerships?
I think one of the best things is to get together, kind of like what we're doing today, Andrea, face to face, we're talking. What we've heard from our partners at the Healthy Choices, Healthy Community Coalition is it's just great to get together, to be able to look over the table and there's the health department director from Boyd County, or there's Chris Crum from the Gwinnett County Health Department, or, Facing Hunger Food Bank is sitting right over here, It's just amazing when we start, over here's pathways, over here, we got all these different experts in the room, and it's just amazing what you can get done when you all work together. So I think I would just encourage everyone to really work together. I've always been that way. Whenever I was the safety security director, if we were doing something right, we figured out how to maybe make a nice impact. Maybe it was our active shooter plan that we thought was working, that proactive, and it was a good plan. Hope you never need those things, right? But it's, you certainly want to have a plan. Maybe we could share that or components of that with others. But I just think that how can you work together? That is a big deal. And really one of the best things I see, particularly post-COVID, is let's get together and let's talk, look across the table. How are you today? How's your family doing? Those things matter, building those relationships. And it really is amazing how all of that simple thing of relationships makes a difference in a positive manner.
I think that's so important you mentioned that too, because with technology, it can be easy to think, okay, I've sent that email, that person knows. But also with emails too, I don't know if you're like me, you can get buried in emails. So like you said, having that face-to-face conversation where you're talking down, you're asking how you're doing, and then you're figuring out what each community member has coming up in the next few months. It really just makes it all seamlessly flow when you're having that face-to-face interaction.
Yes, and there's great people at all these different organizations that show up at our meetings. And you look around our community here, whether it's the school system or it's the hospitals or it's the health department or some of the mental health agencies. There's so many different agencies, and these are my friends. I build relationships with them, but what I have learned is, wow, there are some amazing, talented people. And me or you may not have the answer, but let's put 15, 20, 30 people in the room. So what I've found is you need different perspectives, because you don't know what you don't know, and maybe your education, maybe your experience is what I need to fill that gap. So just getting people in the room to collaborate and talk, get a different perspective, get a unique perspective. And you can really look at that with about any problem, any challenge, really. How can you get a group of people that's multidisciplinary, very talented together, and let's give people an opportunity to talk, to speak, listen to their perspective, even though it's different. It might just be what you need.
Mm-hmm. Yeah, and it all, I think, goes back to that basic thought of it takes a village. I mean, it really does.
Yes, no, that's for sure. And I think that really understanding that a different thought, someone with a different education. I know a little bit about healthcare now, right? So I've been in healthcare for a long time now, and I know a little bit about healthcare, but I'm still not the expert on maybe, let's say, mental health or certain aspects of healthcare. We need people that are experts, on, blood pressure, diabetes. We need experts. We need physicians. We need nurses. We need family resource center people that understand the different risk in the school systems. And so you need all these different perspectives to come together. That's really what it takes to move healthcare forward in a positive manner.
Mm-hmm. Yeah, that's so important. And we are really blessed, like you said, with great community partners in Boyd County and Greenup County. I mean, really, at the Healthy Choices, Healthy Communities, it's something very special to see.
It is. And, not just Boyd County and Greenup County, but also Carter County shows up, and that's wonderful. And Lawrence County, Ohio, we have great representation there. And we really, we had some people there facing Hunger Food Bank from Huntington. So, I mean, it really is open to everyone. But you're right. We try to have a nice lunch. It never hurts to have lunch.
Right.
And but we really want to make it a thank you for what you're doing, because UK King's Daughters really does appreciate all the work, especially the work of the health department. You see me a few times a year coming by and saying thank you, and we have an opportunity to do that. What an honor for me. But we do appreciate all the community partnerships, because we know we need help. We can't do it alone.
Yeah, exactly. It is really, we love seeing you come walking through those doors, especially that one time you brought some pizza with you.
Well, it's an honor for me.
Yeah, we appreciate you so much, and just all the encouragement and the support that you offer the community.
Thank you.
Of course. So we always like ending with a few fun questions, just so our listeners can get to know our guests just a little bit better. So you said you're a Greenup County native, so what can you say is your favorite place in Greenup County, Kentucky?
My favorite place? Probably Greenbow Lake State Resort Park. I helped start the Friends of Greenbow group a while back, and we just recently got brand new tennis courts. So anybody that wants to play tennis, you can go to Greenbow and play on the brand new tennis courts. They're the nicest ones in the area right now. They're
Really?
brand new, yeah. But Greenbow is wonderful. I love to fish, so I'll get in my kayak and go out there and do some fishing. And there's nothing like catching a bass while you're riding in a kayak. And but no, Greenbow Lake out there is a hidden gem, and people that don't get out there need to visit it. But we love it out there.
Yeah, it's beautiful, and it's nice to have a state park right in our backyard.
Oh, it's unbelievable. We take it for granted, but every time I'm out there, I'm like, we're just so blessed. But we love to camp too, so we'll take our camper out, but I love to fish and just be outside. I love to be outside.
Yeah, definitely outside is my favorite place to be too, except for when it's 110 degrees outside like it is right now.
It's a little hot today.
Yep.
My wife and I joke, during the winter break, we'll drive hours and hours to Florida to find weather like this. Mm-hmm. So let's enjoy it while it's here.
Exactly. And then, so what, you mentioned being outside, so what's your favorite way to stay active?
For years I ran, and here the last few years I've still been running some, but I've been a little progressively more walking. And I tell you, it has really become one of my favorite activities, just to walk. Now I have to admit, sometimes I might wipe out a few emails too and things while I'm doing that. But, certainly need to be careful while you're doing that. But no, I love to walk, and I find that as I've gotten a little older, lifting some weights. So that's usually kind of my regular routine of walking, lifting some weights. Becomes very important.
Yeah, that's awesome.
I love playing basketball, but the knees don't say yes as much as what they used to.
Yeah.
But still a little basketball here and there.
Mm-hmm. Yeah, that's awesome. And what is just one thing people would be surprised to learn about you?
I think probably you'd be surprised, Andrea, to learn that I'm a juggler.
Really?
Yes. So I love to juggle, and I've always been a juggler. And basketball camps, like upward event awards night speakers at these churches and things. And when my oldest son, Jordan, he's 28 now, but when he was little, we used to fly quite a bit. We used to go around these different programs. And one time we flew into Missouri, and we spoke at a very large upward program. I juggled basketballs, spin basketballs, and spin one on my son's head, had him walk through the crowd, and just all kinds of stuff. And he'll still talk about today how he signed autographs that day and how much fun we had. But, it might be juggling eggs or basketballs or tennis rackets, but just love to juggle, and always had that odd talent ever since I was a kid.
My next question was going to be, what's the craziest thing you've ever juggled? But tennis racket sounds pretty up there.
Yeah, probably whenever I juggle like a basketball, an egg, and a bowling ball.
Oh my!
It's just very unique and very difficult to do. But I've got some juggling pins, and they're pretty challenging as well. But I love to do that. And sometimes if we're maybe in a store and my wife's not looking, it might be 3 plungers, and she'll get on to me a little bit like, stop doing that,
Oh my goodness. Yeah, that's awesome that you're great at juggling, because I'm sure you're also juggling a lot on a daily basis too. So,
Yeah, it's so much fun. I'm actually writing a book right now, and so for about many years, at least 25 years, I've been also pastoring a church. So a lot of people may not know that, but I pastor Wortland Nazarene also. So I've been what's called a bivocational pastor, working full-time, pastoring a church. But my book's called The Juggling Pastor. I'm working on that right now. But it just basically highlights my life as a pastor, working full-time, at the hospital, taking care of, family. So literally, you're exactly right. I'm a juggler in real life, but also, actually a juggler. So it's kind of funny.
Well, that's awesome. I look forward to reading that book and checking it out when it comes out. Do you have an estimated time frame of when it'll be done?
It's been edited right now. Hopefully in the next couple of months. I'd really like to make it Christmas presents is what I'd like to do, is give it away to some friends and things. But I really want it to encourage people like me, that are working full-time, raising families, possibly serving in ministry also, offer some encouragement to them and maybe a different perspective, and maybe even those congregations who have, quote, a juggling pastor like me, to give them some tools and things to offer some encouragement and support, So that's kind of the idea of it. But I'm excited about it. It's been a fun project, but I will tell you, I've done a lot of things, but writing a book is challenging.
Yeah, I'd be interested to hear more about that process, because I'm sure. How long has it taken you to?
Well, working full-time and family and church and all those things, it's not been high on my list. So I've been working on it for a few months.
Awesome. Wow. Even a few months. That's great that it's wrapping up here soon, it sounds like. So
I hope so.
That's
the
great.
plan.
Awesome.
I'll get you a copy.
Yeah, thank you. I look forward to it. So, Scott, before we wrap up, I just want to personally thank you for everything that you and your team at UK King's Daughters continue to do on a daily basis for our communities. Public health isn't something any one organization can accomplish alone, like we've talked about. It takes hospitals, health departments, schools, businesses, nonprofits, and community leaders all working together towards that same goal. Your willingness to partner with us, support community events, and invest in prevention is making a real difference in the lives of people throughout Eastern Kentucky. It is our privilege to recognize you as our July Health Hero. Congratulations again, and thank you for your leadership and commitment to improving the health of our region.
Well, I'm overwhelmed. July Health Hero. I mean, that is awesome. And I've been so blessed. I'm just very grateful and very thankful. I'm very humble. I'm very humbled to continue to do what I do, and I want to just continue to work with you all and make a difference, But thank you very much for that and that recognition. That means a lot. And I just want to encourage everybody, let's just all work together and let's make a difference for the county that we love, the counties and this area that we love so much, because this is our home. We talk about Boyd County, Greenup County, Carter County, this whole tri-state area, this is our home, and we love it, and we want to see people live healthy, full lives for sure.
Right. I think that's a great note to end on. And Scott, thank you again for joining us today and really sharing your passion for improving the health of our communities. Congratulations once again on being the July Health Hero. To our listeners, thank you for tuning in to the Healthy Department. Please make sure wherever you're listening that you subscribe, like, and follow so you can keep up to date on all things health in Greenup County. We hope today's conversation reminds you that improving community health takes all of us working together. Be sure to like, follow, and subscribe to the Greenup County Health Department on all social medias, and visit our website to stay up to date on upcoming health programs, screenings, educational events, and community partnerships. Until next time, stay healthy, stay informed, and we'll see you on the next episode of the Healthy Department.
Greenup County Health Department. Public health is public wealth.